All right, let's get started. Hello, everyone. Thank you for joining us for another Surya Plastic Surgery webinar. We are trying to do these webinars about once a month to talk about various topics of interest in the plastic surgery and women's health space. And we are building a Surya Women's Health team, and this team consists of several individuals and being led by Dr. DeCosimo, who's also on the call today, and she's going to join us on this webinar to speak about women's health, specifically BioIdentical Hormone Therapy. We also have on this team Kim Bisogno, who's our nurse practitioner, who's been doing women's health and aesthetic services for nearly 20 years. We have Caroline Calaruso, who's an esthetician and becoming much more well-versed in women's health as well, and she's going to be joining us about her experience on bioidentical hormone therapy. We are hoping that Maria Bond is going to join us, and if she joins us, we'll certainly let her in to share her experience with us, and we'll see how that goes. So having said that, let me start by introducing a very key presenter who's going to present a lot of great information on bioidentical hormone therapy. His name is Jonathan Farrell. Jonathan Farrell is the district manager for BioTE Medical, where the passion is to educate and train practitioners and the staff and the general public about bioidentical hormone therapy. There's a lot of misconceptions about this area in the market, and there's some limited amount of knowledge and opinions mostly that we hope to dispel today. So one of the goals of today's webinar is to dispel any myths on bioidentical hormone therapy, and there's several myths that we're going to go through. And if any of you have any questions, just please post it on the chat below, and we'll be able to read it out and make sure that we answer them well. As BioTE company, they're very much committed to the clinicians and the practitioners, and making sure that we deliver great hormone therapy treatment options for the general public at large to manage patients who are suffering from the effects of unbalanced hormones. And so that's an introduction about Jonathan. So Jonathan, would you like to just say hello to everybody?
Absolutely. Thanks for that great introduction, Dr. K. At BioTE, we're a leading innovator in precision and preventive medicine. We've translated over 80 years of scientific insight into clinically validated medical protocols that identify and treat the earliest indications of aging. And exclusively for the use of healthcare providers, we create patient-centric strategies with reproducible clinical outcomes to optimize hormones and extend lifespans for both men and women. We offer a clinically proven, safe, and effective alternative therapy model. And the therapy, it's customized to each patient's needs and delivered in a way that mimics the way the body functions naturally. So let's just dive right into the most common myths of testosterone therapy in women. And so I'd like to ask Dr. DeCosimo, one of the top questions that we always hear is, there's a misconception that testosterone is just a male hormone. So Dr. DeCosimo, could you clarify this a little bit for us and the audience that's on this afternoon?
Yes, hi, good afternoon. Certainly we know that men have higher circulating levels, of testosterone, but however, quantitatively, testosterone is the most abundant active sex hormone in women throughout their lifespan. It's actually measured 10 times higher than estrogen. And also there are more abundant testosterone precursors or pro-testosterone hormones that are active in all of the tissues, including the brain, the heart, the bones, joints, and etc., and basically affect all metabolic functions as well related to testosterone activity. So definitely definitely a myth. Testosterone again is the most abundant sex hormone in women. So, and I'm not sure why you can't see me.
That's okay. We can hear you. Yeah,
I know the camera. I'm not getting a camera prompt.
Well, here's another myth that's out there is, it's about symptoms. So, can you tell us what are the common patient complaints or symptoms that are associated with low testosterone?
Well, we see our patients most of the times present complaining of low energy, fatigue, brain fog, loss of memory, loss of focus and concentration. They're also irritable, anxious, depressed, complain of insomnia, not getting restful sleep, loss of sex drive, definitely an important one in the GYN arena, night sweats, joint pains, and weight gain. I mean, that is a significant one that I see in my patients where they're complaining that they're actually gaining weight despite efforts to trying to lose weight. And it becomes very frustrating.
So then when you do that testosterone replacement in those patients, how do they feel?
Well, we start seeing that, patients will, once they have optimized their testosterone levels, they notice a definite increase in energy. They also see the weight coming off. By having more energy, they're also able to exercise and have the ability to, again, have their efforts pay off in terms of weight loss. They are less tired. Basically, it just basically makes them feel overall better. It's quality of life, improved sex drive, improved, as we said, energy, focus, restful sleep, and also all of the other benefits seen to weight loss. I think that's one of the big ones that I see with patients that are so happy with the results.
Sure. So those are all great benefits. But, there's a myth out there that, okay, it's only some symptom relief. What else, as far as health benefits, are there with replacing testosterone, actually optimizing testosterone in females? Or are there no other benefits?
No, most definitely. I mean, one of the most important benefits is reduction in heart disease. And if you look at heart disease, it's the most common cause of death, both in men and women. And we see 1 in 7 premenopausal women that actually die of heart disease. And once women reach menopause, it's more like 1 in 3 women. We see as a statistic, too, that more than 200,000 women die annually of heart attacks. That's 5 times more than women dying of breast cancer. So if we can reduce, that, I think that's significant. The way BioTE or optimizing your testosterone helps decrease heart diseases by many mechanisms, but clear and simple, most of the times it's related to decreasing bad cholesterol, improving good cholesterol, decreasing inflammation in the blood vessels. And so those are some of the mechanisms where it helps in terms of reducing, heart attacks. In terms of the brain, it helps reduce the risk of Alzheimer's and dementia. And that's important too, as that's a very common disease later on in life. It helps with osteoporosis in terms of increasing bone mass. And again, we see that women, if they have osteoporosis and God forbid they slip, fall, break a hip, less than 50% of those women will regain pre-fracture mobility. So that is definitely not the way most of us want to spend our golden years. And again, it's going to help improve the tissue quality in terms of the genital tissues with vaginal lubrication, sensation. It's helping with libido. It's helping with joint pain as well, which is another thing related to the musculoskeletal system where patients complain of aches and pains. And so you're going to help minimize that as well. So those are definite. I also mentioned a big one now that recent studies have shown that testosterone optimization will also help reduce the incidence of breast cancer in women. And that is significant as well. So we have the 2 main causes of death in females, which is heart disease, number 1, and breast cancer, number 2. And we can definitely decrease those significantly by optimizing hormones that will improve not only your overall, physical health, but also mental health and well-being.
Wow, that's a lot of advantages for bioidentical testosterone use in females. Thank you for that answer. A lot of women, though, they think that if they use bioidentical testosterone or just testosterone replacement, that it's going to increase their risk of breast cancer. So can you just clarify this? How does bioidentical testosterone utilization in a female, how does it affect their risk of breast cancer?
Well, we know from the studies that testosterone actually has a beneficial effect on breast tissue. It's protective and it reduces the risk by up to 75%, as I said, in recent studies. And basically what it does, testosterone just decreases breast tissue proliferation. And proliferation is, overgrowth, which is what is seen in cancer. And it also prevents stimulation, and sometimes stimulation that is due to estrogen. And women who have high fat content in their body are going to be producing more exogenous estrogen as well. So it's really important to balance both, estrogen and testosterone, because that's what that balance, that healthy balance, is what is going to give women the protective benefit against breast cancer.
Thank you, Dr. DeCosmo. You're truly an expert in bioidentical hormone replacement therapy. My next question, you're welcome. Your next question is going to be for Kim, and it's in regards to, I've said bioidentical, we've said bioidentical a couple of times. So Kim, can you clarify what does bioidentical mean?
So bioidentical is a plant, or BioTE is a plant-based product instead of synthetic, meaning made out of chemicals. So this plant-based product is human identical molecule, which is readily available to the receptor site. So it's able to be used immediately without having it to be broken down. The chemicals itself be broken down and then be utilized. So that's what bioidentical means.
Great, thank you. There's another myth with testosterone therapy in females, and it's about masculinization. And it's, are women going to grow beards when they use this bioidentical testosterone?
So we regulate that. Yes, they can, but we regulate it with their blood work. We want them to get the most results at the lowest dose, but this also is mostly side effects of the oral synthetic and anabolic steroids or hormones.
Great. So what age would a patient that you put on bioidentical testosterone, when do they stop therapy?
There's no age limit. If you are feeling bad, no matter what age it is, and you need symptom relief, we just keep on using it. So there's no age on there. So you are as old or as young as you feel. So we are trying to maximize your hormones so you don't actually feel your age, you feel younger.
So, Kim, there are some patients that think if they stop their bioidentical hormone replacement therapy, that the symptoms that they had before they were put on therapy are going to be worse. So could you explain that to us?
Well, it can't be worse. Your symptoms are just going to return just like they were before you even started. So because it is a product that is bioidentical, it comes right out of your system. So you will experience the symptoms you had prior to starting them.
But they won't be worse.
No, definitely
Right.
not.
Okay.
They're going to be exactly what they were before. But no worse.
Also a lot of patients, they think, well, hey, I can just optimize my hormones by, how about therapeutic lifestyle changes? Diet and exercise alone. I can do it. I've heard it.
Now I appear.
Diet and exercise are great, but they are not going to replace the hormones that we lose as we age. So exercise and diet are great to help with the BioTE system or the BioTE pellets, because we need that cardiovascular movement to absorb that. So no, it's not going to exercise and diet is not going to replace the hormone levels, unfortunately, as we age.
Well, thanks for this valuable information, Kim. You two also are an expert in bioidentical hormone replacement therapy. We appreciate your expertise, Dr. Cosmo and Kim. And we should have a couple of case studies. Mrs. C, are you on the line? There she is. Can you tell us a little bit about your experience from bioidentical somewhere else, then you switched over to Surya, and so tell us about your patient experience of hormone optimization at Surya versus where you came from?
Absolutely. So I started about 5 years ago. I started feeling those symptoms of a little bit. I didn't have much energy. Believe it or not, I work out daily and I've always been very thin. So I never thought it would affect me around the waist, the weight gain. Like I said, I eat very clean. So I was surprised when I started feeling all those symptoms that you were talking about, gaining the weight, which I was very surprised. So when I went on hormones 5 years ago, I started feeling a little bit better, but those symptoms weren't going away completely. So then when I saw BioTE and I tried BioTE, and the method is very thorough. You like checking the thyroid, I think was a game changer with me. And I feel so much better.
That's great. So Dr. DeCosmo and Kim are both BioTE certified clinicians, experts in their field. And so would you say it's been a better experience for you personally?
Oh, absolutely. And with the medical grade, the pharmaceutical grade nutraceuticals, I think it's fabulous because it keeps my, sustaining the hormone balance. So it's really good. Really
Excellent.
good.
And certainly, let me just add that at Surya, we're able to have that one-on-one contact with patients. So we're always available to answer any questions, to alleviate any concerns. And I think that's important as well. That's reassuring to the patient because we're with you every step of the way.
And now, we're in this COVID world. So you all have kind of switched gears and have done some virtual patient, health assessment or
consultations and pre-hormone assessments. Definitely, we're available usually every day of the week to be able to meet with patients via telemedicine.
Excellent.
So let me say something about that. At Surya Plastic Surgery, which is the parent company, essentially parent practice, we want to have a specialized division called Surya Women's Health. Because a lot of the patients that may seek help with hormone optimization because of the way they feel or don't feel also have similar concerns about looking good as well, because this is all synergistic. When somebody wants to really be healthy, you want to look good and you want to always feel great, and they always work together. So we want to provide a comprehensive center that basically addresses almost all the needs for living your best self and your best life possible. That includes optimization of hormones, that includes wellness, that Dr. DeCosmo offers, that includes fillers and injectables, that includes some surgical services, that includes skincare. Because one of the things that, from what I'm not an expert in bioidentical hormone therapy by any means because I'm a plastic surgeon. However, what I'm learning is, Dr. DeCosmo and Kim, correct me if I'm wrong, but would that help with skin health as well, and all those other aspects that make someone look better also?
Definitely. The hormones will improve collagen production and fibroblast activity, which is, as you know, essential in order to maintain the results that you're able to give patients. So it is indeed a synergistic effect, both acting together. You want to certainly look good and feel good, but also be able to maintain those results by improving the internal structure of the tissue. And we know that all the skin tissues and the subdermal tissues have abundant estrogen and testosterone receptors. So important.
Great. Thank you.
Excellent. Dr. K, do we hit any questions from the audience that have come in? Any hands up there?
I'm monitoring. I have not gotten any active questions just as yet.
So this is a question that we hear a lot. Maybe Dr. DeCosmo, you could answer this question. How long does it take for, let's say, body changes when you get your hormones optimized? This is something that happens, next week, month, year. Can you maybe set a timeline?
Usually, patients will start seeing benefits actually as soon as just a couple of weeks of getting their pellets. In terms of symptom relief, I see that patients that come in complaining mainly of like hot flashes or night sweats or problems sleeping, those seem to be the symptoms that are more often relieved pretty much immediately. I would say within the first couple of weeks, which is great. Then the other ones obviously are going to take a little bit more time, and but by the maybe the end of the first round of pellets or beginning of the second round, you're going to see patients just ecstatic with the results in terms of the ability to lose that stubborn weight that's been really plaguing them, to have the energy to want to exercise, to have the energy and the will to want to have sex again and enjoy your life. So those things are definitely a little bit longer term, but we see them in the immediate. I mean, we're in a time where everybody wants instant gratification, and that's understandable. And I think that reasonably, the BioTE method is able to produce those results within a 3 to 4 month period. So that's significant.
I have a question that I think probably it didn't come up now, but it did come up recently with a patient. Can somebody who is already in menopause start having menstrual cycles if they go on these hormones? And if that's the case, how do you manage it?
Yeah, well, if you've been in menopause, then theoretically, you've been, the definition is 1 year without a menstrual cycles. If you start hormone replacement therapy and start bleeding, then it is probable that the hormones can be a little bit out of whack. So 1, they may require a little adjustment. 2, if we adjust hormones accordingly and we still see problems with bleeding, then thankfully, as with my GYN experience and expertise, we're able to work that up appropriately just to make sure that we're not stimulating any abnormal cells. Sometimes patients may have, and very frequently women will say, oh yeah, I've had polyps or fibroids in the past. And those can sometimes get a little annoyed with the hormone therapy. And again, if that's all that it is, then again, just tweaking the hormones will resolve that. And then we usually can follow up with ultrasounds and biopsies if necessary. But we have all the tools to ensure that all our patients that are on hormones, if experiencing any adverse side effect, can be managed appropriately.
So I have a follow-up question to that. So it's interesting that as a non-expert in hormone replacement therapy, I'm a plastic surgeon, but I deal with a lot of women in my practice. So one of the things is that if there's so many health benefits to doing this, how come it's not more popular or more people do it? I mean, it seems, if this is all obviously true and it's as good as it is, how come it's not more popular out there in the marketplace? And why aren't other physicians like OBGYNs offering it?
I'll let Jonathan answer that because it has a lot to do with the pharmacological industry and the days that we live in.
And it's pellets are not new to the U.S. They've been around since 1939, and it's if somebody isn't up on something, i.e., they haven't been trained, well, they kind of get down on something as well. So we have 2 experts here today that have done an excellent job of answering these questions, but that's usually why people haven't heard about it, because if a clinician has not done the continuing education, they're not going to know about it. And so you have 2 clinicians here now at Surya Women's Wellness that are experts in BHRT. And
I'm not sure if you're able to speak a little bit about the issue that these are natural, bioidentical chemical compounds. So therefore, they're not necessarily commercially available. And if they're not commercially available, there's little profitability when it comes to the big pharma companies. And that in turn, too, affects the widespread knowledge of the benefits of these natural components.
Human identical, meaning it's the same product that the ovaries and testes have made since day one.
Correct.
So, sure.
I think also in medical school we are treated that are taught on a medical base, not on alternative medicine. They're not up to date on that. I'm just as guilty because I'm not that great on alternative medicine until BioTE. As we get into practice, we start hearing other things, but even the pharmaceutical companies are constantly bombarding us with pharmaceutical medications, not bioidentical medications or alternative medications.
So we had another patient case study, but I don't think Mrs. M was able to make it today.
I believe she is. So I think she's here. So she should
We'd
be.
love to hear her her case and her story.
So for just a moment, I'm going to take you off, Jonathan, so I can allow her to speak as an attendee. Is that all right?
Absolutely.
Is Maria able to speak, the patient?
Hello?
Yeah, we can hear you.
Oh, great. Okay. I don't know why I don't have video either, but that's okay. Yes, I started bioidentical hormones 9 weeks ago, and I had all of those symptoms. I had the brain fog, the tiredness. I had a low libido. It just bombarded me for the past 5 years, and I thought I had to live with it. And then getting all of this great information, it changed me. I'm a happier person. I feel more in tune with myself, and definitely the libido is doing much better. My husband's really happy.
Great. Thank you for sharing.
Thank you.
Okay, Jonathan, you're back on.
Great, thank you. So if we don't have any other questions, that's all I've gotten for questions.
Okay. Well, I can close this off. I think, short and sweet is always best. We've been on for about, almost 30 minutes, and I think that's good. So I'm going to do one more call for any. Oh, so there's a question here that just came up. How painful is it to do the insertion of the pellets?
Yeah, Dr. DeCosmo, can you answer that for us?
It's actually not painful, not more painful than just getting a shot. Like if you were going to get your flu shot, we basically numb the area with a little bit of local anesthetic. And after that, all you're going to feel is a little pressure. And really, honestly, the procedure itself takes under 2 minutes. So it's very quick.
So I have a question actually that maybe the audience might want to know. How do I get started? So the first thing you do, you come in for a consult, and we answer the questionnaire. We talk one-on-one. What are you feeling? We also do some blood work. And then we have you come back, and based on that blood work, your symptoms, your age, your weight, and then we determine together what is the right dose. Then we follow up in roughly 8 weeks. And you do another questionnaire, and we do more blood work. And if there's any adjustments, we do the adjustments there also.
And I'd like to add that, this way of replacing and optimizing hormones is the best way, because you are starting out with some blood levels, and we're not just giving people kind of cookbook type of doses. We're adjusting and personalizing everybody's individual dose. So that's important.
So a couple of more questions that just came up, but one of which is, I think we discussed it briefly, but we can maybe say it again. How long before patients actually start feeling the effects of the treatment?
Right, I think we did mention that the results are actually visible within a week or two of getting the pellets inserted, and the results continue beyond that, and usually within the first round of pellets, which usually in women it's every 3 to 4 months, they're going to have resolution and improvement in a lot of their symptoms.
Okay, 2 more questions that came up, but one of which is, if you're on birth control already, is there an issue with these treatments?
Well, we're looking at a lot of different hormones, and a lot of the hormones that are in birth control are mainly the estrogen and the progesterone. So we are also optimizing testosterone and thyroid. So those a lot of times are the ones that require optimization in women that are pre-menopausal, meaning still having their menstrual cycles, therefore requiring contraception with birth control pills.
So it's not a contraindication, meaning you can still deliver bioidentical hormone therapy because you're optimizing testosterone and maybe thyroid, while the birth control pills are managing their estrogen and progesterone. And
That's correct.
The protocol is still the same, meaning you check their blood levels of all hormones and, kind of guide them accordingly, and how does, for example, if a patient is getting their hormone treatment from a different OBGYN or a family practitioner, and, for example, Surya Women's Health is doing the bioidentical hormone treatment for them, how does the collaboration actually work?
Kim?
So let me clarify. They're seeing their regular OBGYN, and
Yes.
they have bioidentical hormones from them, and now they're coming to us. Is that what the question?
No, they're getting their birth control treatment from their OBGYN. But they've heard about this great webinar and they want to try it out. And so they come to Surya Women's Health and they want to try it out. And so they, obviously have questions. Do I need to speak to my OBGYN? Do you need to adjust it or regulate it? And if you do get, blood work done and they look at their estrogen levels or progesterone levels or whatever else you look at, do they have to have any collaboration with their OBGYN, or do we have to talk to them about any of that?
We always recommend collaboration, but because of her previous OBGYN is not familiar with this, they might not be up to par with collaborating with us. But since we have Dr. DeCosimo, she can take care of their birth control and do their annual women's well checkup. So that is depending on the other side, where they're coming from, whether they're willing to collaborate with us or not. And if they're not, they could also see Dr. DeCosimo. First of all, we could call out to them and ask them if they're willing to listen or collaborate with us. It depends if they're open-minded or not.
Okay. So as a plastic surgeon, I have one last question. Personal, this is my question. So obviously, if you're going to insert pellets, you have to go through the skin at some spot in the buttock area, the upper part of the buttock area on one of the sides. So do you guys typically recommend doing it at the same site for repeated injections, or do you constantly change the site of where it's inserted, like whenever it's done every 3 to 4 months?
We always alternate the side. So we always document if we start on the left. If in 8 weeks when they come back, they need a booster, we'll do it on the right side, and then vice versa. And when round 2 comes, we'll go back to the left side. So yes, we try to alternate on each side of the gluteus.
So does the buttock look like a minefield of scars there because you go so many times, or does it heal so nicely?
No, it heals very nicely.
The incision itself is probably about 2 to 3 centimeters. I mean, tiny. It's negligible. You won't even see it.
We don't even put stitches in it. It's hold very strips and it closes on its own. There's just some contraindications of bending down, doing squats, doing anything excessive with the hip,
the gluteus muscles,
bicycling and stuff like that. Not taking a bath for a while, but you can definitely take a shower.
Well, guys, I've certainly learned a lot myself here. Thank you. Every time I participate in something like this, I also learn, because when I see patients, if they ask me, I know more to talk to them about and refer them to you guys to offer these services. So, well, thank you, everyone. Thank you, Dr. DeCosimo. Thank you, Jonathan. Thank you, Kim, Caroline, Maria, everybody who joined us together.
Thank
and
you.
for the audience, we're going to do these once a month on various topics of interest. So please look out for some additional information that's going to come out on our social media sites. Thank you. Have a great day.
All right. Have a great day. Stay well. Bye.